What do you think the chances are that you may tear your ACL? Don't ask me, I'm biased. I have torn my ACL on both of my knees. Hi, my name is Taylor Burton, and in this speech, I will be covering anterior cruciate ligament tears, also known as ACL tears, something that can happen to anyone on a daily basis, although it is more likely to happen to those who are involved in sports. I have torn my ACL on both of my knees, once in high school and once in college. I have gone through one procedure and learned a lot along the way. As college students, most of us have participated in sports regardless of whether it was organized or just for fun. If not sports related, then some sort of aerobic fitness activity. Activities as little as walking qualifies us to possibly tear our ACL. The information I will provide can be very useful, even though you may not think so. Throughout this speech, I will be discussing 3 main points. The main points being the possibility one has of getting an ACL tear, how it occurs, things that can help lower that possibility, and how to recover fully from an ACL tear. Tearing your ACL is something that can possibly happen to anyone. Majority of the time, it includes the involvement in sports. About 200,000 people are diagnosed with ACL injuries per year. Within that number of ACL tears, 70% happen with no contact and 30% are with contact. Females are 4 to 6 times more likely to experience this injury than males. Majority of ACL injuries occur in athletes. It is possible for someone to tear the ACL if you twist your knee, suddenly stop in place, shift your knee, weight from one knee to another, jumping and landing on one knee, overstretching your knee, and having the knee hit directly. Your ACL tear is usually diagnosed by a physical therapist, athletic trainer, or orthopedic surgeon. It is possible for you to have an idea of your injury by realizing if you hear a pop when the injury occurred, if your knee swells within the first couple of hours, if your knee buckled or gave out, and if your knee possibly feels unstable or as if it is disconnected. There is no way to 100% guarantee that you will not experience this injury, but there is therapy and exercises to lower that possibility. There are physical therapy programs in which are designed in order to improve your performance, strength, and balance. This therapy also strengthens your abdominal, thigh, and leg muscles, which help you prevent injuries. PT should last no less than 6 weeks, and exercises should be performed at least 2 to 3 times a day. Wearing braces can also reduce your chances of tearing or re-injuring your ACL. Most people have reconstructive surgery after tearing an ACL, but there are also a separate set of patients who have the potential to heal without surgery. For example, if your knee did not give out during the time of injury. There are multiple ways to conduct the surgery. You can use a graft, another tendon or a ligament, and possibly some of the old ligament. If having surgery, most therapists have you start some PT before surgery in order to reduce swelling and help your range of motion. After surgery, treatment can include, but are not limited to, the requirement to bear weight, ice and compress, brace your knee, use electrical stimulation, movement, strengthening, and balancing exercises. Most of the following are done in post-op physical therapy. The general recovery time would be about 9 months, and then you can return to sports or normal activity. Without surgery, you would also be a part of PT with similar requirements, such as electrical stimulation, strengthening exercises, and balancing training. It is very rare to heal without surgery. In conclusion, everyone should understand the possibility of experiencing an ACL tear, how it happens, things you can help prevent it, and how to recover from it. Majority of people who experience ACL tears are female athletes, but it is very possible for either gender, whether you are involved in sports or not, to experience this injury. Thank you all for listening, and I hope you have learned a lot throughout the speech. Now I will show you a picture of my knee after my ACL surgery.